Let's Cover That podcast is brought to you by CM&F Group, professional liability services for over 200 healthcare professions. Visit our website at cmfgroup.com/podcast for more info.
Hey everybody, Will Sullivan here with another episode of Let's Cover That with my co-host,
Antonina Agruza. And today we have with us Erica Jain, the CEO of Healthie. We last spoke with Erica in August of 2022, which is about 10 months ago. Erica, it's a pleasure to have you back on the show. Thanks for joining us again today.
Of course. Thank you so much for having me back.
So it seems like a lot has happened in the last 10 months. Can you tell us a little bit about Healthie and what's been going on since August?
Yeah, absolutely. It's been overall incredible to see the continued momentum in the digital health industry, even as we've read the news of so much happening in tech overall and consumer tech and fintech. There's really still this renewed sense of innovation and momentum when it comes to the digital health industry. And we see that every day reflected in the growth of our customers. Our customers are building relationships with health plans, with employer groups, going D2C, whatever their business model really supports. We continue to see that rapid level of innovation. To us, that's an indication that this market is still on fire. There's so much opportunity and there's so many great things happening at a high level. What we've also learned in a way that even we didn't predict in the early parts of 2022 was that this real conversation of build versus buy in-house when it comes to picking up core pieces of your tech stack has shifted so dramatically. I think at this point now, the question is not, should I build or should I buy? But it's really what am I going to buy and how am I going to use that to augment my internal capabilities? So many of these virtual first digital healthcare companies are really running the analysis and saying that because of platforms like Healthie, we are able to focus on clinical care, clinical capabilities, member experiences, and reporting analytics, and buy core pieces of non-differentiating infrastructure. So that has been particularly interesting to see.
So it's interesting talking about that because you look in the healthcare segment and, from the brick and mortar hospitals, inpatient, it continues to shrink, merge, places are shutting down, but then you have this expansion in the outpatient sector, which is really where you all are so focused on. So when you look at that, and like where you stem from, what are the new verticals within healthcare you've been expanding? You go from nutrition, you're looking at therapy, but now you gain in family care and other areas. Are the ones that you're seeing really get big impact with Healthie kind of leveraging their clinical capability? What are you seeing as you have shifted over?
Yeah, that's a great question. Well, let's take a step back and think about where healthcare is moving. The way we think about that at Healthie is, in many ways, healthcare is shifting away from the hospital and into whether it's retail clinics, gyms, universities, virtual care at the employer on site. And what's happening is that, people go, and I always use the example of like women's health. You go into the hospital to have the baby, but then everything outside of that one experience to have the baby can now happen outside of the hospital. So those are time, attention, and dollars that are moving away from the hospital. And I take that a step further to say, well, there's really a new industry being created. And that industry is the antithesis of Epic. And it's the unraveling of all healthcare being tied to hospitals to there is a real fast growing, needed, and innovative way to receive healthcare as a consumer that does not need to be in the hospital. And that's really what all of these digital health innovators are enabling, supporting, moving fast on. And ultimately, that is a very good thing because that is what will improve healthcare outcomes and reduce costs, whether it be cost of readmission, whether that be cost of care, whether it be cost of prescriptions. But that's what gets us going at Healthie because we see that every single day through the thousands of organizations that we work with. And when you think about how you create those healthcare experiences outside of the hospital, we go back to 3 product principles, and this informs how we build our platform. One is collaborative, where you have multiple healthcare providers working together to perform the exact right type of care for a particular patient. You have longitudinal, so the same provider of care is working with the same receiver of care. Provider of care can be the same clinician, or it can be the same group of clinicians or organization, but you have our customers just building those longitudinal relationships. And the third is virtual first. That does not mean the care happens virtually or exclusively virtually, but all health is digital health in this day and age, whether it's as simple as a text reminder for an appointment, or logging your metric, your blood pressure, weight, and just like having someone view that remotely. That's all digital health. So it's all virtual first digital health. Everyone's doing that. But those are the 3 product principles by which Healthie builds for. And that's been true since we started the company 8 years ago. And so you think about the types of verticals that naturally supports. We started in nutrition, right? And it just turns out that the healthcare and medical industry is moving in the direction of how how dietitians have been practicing for years, which is frequent touch points, long-term relationships, habit change, a focus on the internal and as well as the outcomes. So we're seeing a tremendous and needed amount of growth in verticals like nutrition and weight loss, women's health, behavioral health, family care, peds, primary care. And that's a really, really, really good thing for the industry overall, because it means that organizations are delivering care outside of the confines of reactive hospitals.
So now that you guys are moving into all of these, larger verticals, how are you finding that's helping businesses scale out more quickly?
It goes back to the premise that I believe that all businesses need to be the best in one thing, and then partner and build relationships and buy other companies and softwares. And that's how healthcare overall and the industry overall moves forward quickly. So when it comes to like Healthie's value prop, we have our core platform. We have, scheduling, EHR, client engagement. What we are then doing is partnering with so many other healthcare builders and innovators, someone in CRM, someone in RCM, someone in clinical ops and data analytics, and the list goes on, content creation. And that's how we in total create and enhance the size of the pie and move forward together faster versus everyone trying to build things in-house that end up not being best in class and end up serving nobody.
Yeah, that's it. That's amazing, kind of coming in from a decentralized standpoint, but everybody kind of driving at the same focus and objectives, which is a really meaningful shift. How do you, when you're thinking that through, Erica, like who do you see as like meaningful partners that you have been collaborating with throughout the year and future facing that you're excited about?
That's a great question. And, since I was last on with you, over the last 10 months, we've built some incredible partnerships with other players in the industry. For the data as a service, we've got Zeus. For the RCM, there's a handful of incredible vendors in this space. For ClinOps, there's some great vendors in this space. And so it just comes back to the fact that everyone is building and innovating in healthcare. You don't need to build everything in-house, and you will not win if you build everything in-house. And so we've really been able to build close partnerships and go to market with other great companies, eLabs, ERX, claims submission, claims eligibility checks, the list goes on. But that's what what our customers are asking us for is, hey, I don't want to build this in-house. Can you guys help me provide this functionality and just get me going so I can focus on what I do best, which is clinical care?
Very cool. Can you share any insights or lessons learned from the experiences of GetHealthy.com over the past year that might be valuable to other entrepreneurs or individuals looking to create their own healthcare platforms?
I'm amazed every single day at what our customers do and how quickly our customers are growing. When I think about what the winners in the care delivery space are doing, it's a few things. It's one, really focusing on the care experience. So that starts at the matchmaking. All of this is possible through Healthie, right? But you say, how am I going to match the best provider of care with the best receiver of care? Because that's going to set the foundation of a strong partnership. And the second part of that is, what's the experience after that first session? And how am I going to continue to engage them? Because change does not happen with one session, whether that's women's health, behavioral health, nutrition, coaching. It's about that long-term relationship. So they're very, very, very focused on that long-term client relationship and that member of experience. And then number two, they focus on distribution. So whether that's D2C, whether that's B2B, whether it's a combination thereof, and there are so many conversations about that going on right now, which is important, right? Because it's how do you partner to achieve scale? I think the really, really strong founders think a lot about that, not just what they're going to do for 6 months, but what they're going to do for 12 and 24 months. And then the third piece is around clinical outcomes. And there's a really high barrier around clinical quality, clinical excellence, and then coupling that, of course, with initiatives like value-based care, lowering costs, and looking at the holistic experience, which I think is really important. But in order to sell, like it's hard to get the distribution. You have to have something differentiated. And in healthcare, what that means is that you're better, it's proven, it's lower cost, and that's the equation.
Yeah, also I love the idea that you're just focused on, like, you have collaborators, they're focused on their areas and their runway. And because when you're running a business, if you focus in too many areas, you just spin and you find yourself in the same spot that you were, like you're saying, if you've got 6, 12, 24 month, objectives, you're going to be in the same spot in 13 months. And I think it's really cool to see the frame of mind that you have, kind of in similar pathway to the folks that you're working with on as entrepreneurs. So when you're looking at priorities for you coming up 6, 12, 24, what do those kind of priorities look like, and how are those different than what they could have been 2 years ago? Like, how has that shifted for you as you develop as a leader?
That's a great question. So we are in the thick of high growth mode in a way that we were in 10 months ago when we last talked. We weren't in 24 months ago. So our company size has doubled in the past year and will continue to grow quickly. And what that means for us as founders and leaders is what we spend our time on and what we think about is different than it was 10 months ago. And if it was the same, we would not be growing as leaders. So from a day-to-day perspective, what that means for Kevin and myself is that we're really thinking about how do we take care of our team? How do we set priorities and OKRs in order to make sure that, when our team wakes up, they know what they're supposed to be working on in order to fulfill our company's mission. And of course, hiring and capital allocation is just the important part of the job on my day-to-day basis too. From a product perspective for Healthie, we are differentiated and we are the best at what we do because we have such a focus on product and engineering. And we know that our customers are coming to us for business critical, healthcare critical software. And that's a responsibility we do not take lightly. And you'll see that in how we think about product development, product stability, product performance, new improvements and partnerships, because we're an enterprise grade SaaS platform and our company is what is our product. So we also do put a large amount of emphasis on just making sure we continue to have the best products on our market for our customers.
Exciting, and we can't wait to hear more about what you guys have coming up. Erica, before we wrap up today's episode, is there anything else you'd love for our listeners to hear about what Get Healthy has coming up?
That about covers it. We're so excited to just see the continued innovation in the digital health market. We are the biggest supporter of founders, whether you're pre-seed or IPO. And it's just been so incredible to watch our customers grow their businesses, think strategically about the different ways to grow and build. And the number one thing to impart is that this is a game of resilience, because companies take years and years and years to build. There is no such thing as overnight success, particularly in healthcare. And it's just incredible to see the resilience of the founders that we work with every single day and the drive to make healthcare better for everyone.
Awesome. Well, thank you so much, Erica, for hopping on with us. And that's another episode. Let's cover that.